Hey, Kenneth, I don't feel good. I need to check into the ER now.
I have never seen you like that before.
Hi, I am Leftlateral. I am an X-ray tech in a hospital. I am a part-time in weekend nights. I work 12 hours per night back to back. Tonight, I will share my ER experience in this video. In this video, you will learn why hypertension, high blood pressure, is called the silent killer. And you will learn how to monitor your blood pressure and when to go to the emergency room. Before I talk about myself, I will show you how my ER patients come to get help. It's medically necessary for technologists to ask patients why they came to our institution when we examine them. Recently, I had an exchange like this. So, what brought you the ER? A male patient 70s replied.
I don't know, I just don't feel good.
That's a very common answer these days. I turned to his wife. She said,
High blood pressure, anxiety. He is anxious because he has high blood pressure.
His wife seemed to be more aware of the danger and symptoms of high blood pressure. It's called hypertension, and also silent killer. You feel headaches, getting tired easily, dizziness, nosebleeds, chest pain, shortness of breath, and it leads to heart attack and stroke. When you feel sick but you don't know what's causing it, you should check your blood pressure immediately. If the number is unusually high, go to the ER. Or, you should lower the blood pressure as quick as possible. During the pandemic, as you know, many COVID patients came to emergency room. Many COVID patients were admitted to the ICU and other floors. All the hospital staff worked every day and night tirelessly. But, many staff got infected with COVID and had to stay home for a specific time. The hospital had to get help from the government for the workforce. In every department, employees were asked to work extra hours. I worked overtime even though I was part-time. The hospital institution gave incentive bonuses when the employees encountered COVID patients. In the beginning, we were able to stretch our availability willingly. Working overtime is usually okay once in a while. But if you do it every week for months without a break, you will be sick. That's what happened to me. In the spring 2020, COVID patients started showing up in the ER. We followed the Airborne Plus protocol carefully, wearing an N95, a face shield, a gown, and gloves. In the first year of the pandemic, we did okay. Next year, 3 vaccinations were available, and it was mandatory. It helped us immensely. However, the second wave came, then the third wave came. 2021, 2022, it was non-stop. We were exhausted. There was always someone who was sick in the department. We were constantly understaffed. Many quit their job, especially ER nurses. In radiology, the institution required all staff to work extra also. Imaging exams are very physical for the techs. After working 40 hours a week, you become exhausted. Therefore, only those who had ambitious or young employees could work extra. A part-time like me worked just like a full-time. Since I am a night tech, I function best at night. However, the management believed I could work any vacant shift. They asked me to work mornings and afternoons. They were desperate to fill positions too. I did my best to help fill the shift. I mainly helped in afternoons and weeknights. So, some weeks, I worked 40 hours, some weeks 48 hours, and so on in 2022. However, gradually, my body got fatigued. When you get too tired, you become unable to sleep. That's the first sign that your body needs sleep as much as your body requires. Once I agreed to work the shift, I didn't want to call in sick. Now, I think of it. I should have checked my blood pressure and called in sick. But I learned the hard way on the night. I didn't feel well in April 2022, my regular shift, Saturday night. I told myself if wasn't too busy, I could make it. A little after midnight, I felt very sick and weak. I just wanted to lie down and sleep. I would call this narcolepsy. I felt fragile, so that I may drop the X-ray plate onto my foot or the patient's head. So, I had to call my supervisor and check into the ER. Because I was an employee, the ER staff tried to give me the fastest service. Mike, the RN, gave me an individual room and took my history and vital sign. Usually, I was very healthy, but the RN told me my blood pressure was 160/140. That was unbelievably abnormal for me. An ER doctor came to see me. I told him it must be narcolepsy, and I was exhausted. I mentioned slight pain in the muscle around the right shoulder area. The doctor ordered a chest X-ray, a blood test, and pain medicine for the shoulder muscle through an IV. I rested on the comfortable reclining chair for an hour or so while waiting for the result and discharge. The doctor gave me a note for 2 days off work and an instruction to follow up with my primary care doctor. When I got home, I crashed into my bed and slept like a log. Reading the discharge instructions, the ER doctor diagnosed me with fatigue, with which I agree. In a few days, I went to see my primary care doctor, Dr. Garcia. I told him I was exhausted and wanted to go to sleep. He acknowledged my high blood pressure and gave me 2 weeks of FMLA. His diagnosis for me was unstable blood pressure. I didn't need to go back to work for 2 weeks, and I finally improved. I told my supervisor that it was not a good idea if I work more than 40 hours weekly in a mixture of different shifts. High blood pressure or hypertension is called a silent killer. It may cause a heart attack or a stroke. Since this incident, I have carried a portable blood pressure cuff. I check my blood pressure when I don't feel good. It might be difficult for healthy people to understand how high blood pressure occurs. It could be any of the following: hereditary, aging, smoking and drinking alcohol, taking too much sodium, stress, anxiety, and so on. Because of those causes, blood vessels become hardened and the heart has to pump the blood more forcefully. An artery of the heart or the brain may blow up and bleed, and you will have a heart attack or stroke. It's terrifying. So, you cannot underestimate this silent killer. Here are the ranges of blood pressure you should remember. If you are prone to hypertension, I recommend recording your blood pressure each time you measure it. Get a wrist blood pressure cuff from a drugstore. Take your blood pressure at least once a day. Take a picture of the result on your phone. You can show the series of pictures to your healthcare professional. Or, upload the video to YouTube and keep the status private. To share the record with someone who needs to know. How did you like this video? Thank you for your viewing. Let me know what you think about this video in the comments. If you like this video, please give me a thumbs up. I will continue to deliver videos about the darkness of the hospital, so if you are interested, please subscribe to the channel.